One of the hardest things to develop as a student nurse and a new grad nurse are critical thinking skills. I'm Nurse Nyla, and I'm going to break down the 6 things you need to know before entering any patient's room as a student nurse and a new grad nurse. The first thing that you need to know is, what is this patient's diagnosis? You need to know this patient's diagnosis because you need to know what symptoms are expected of this patient. Did this patient just have surgery? An expected symptom of surgery would be post-op pain, so that when you go into that room and that patient tells you, "I'm in pain," you don't panic because it is an expected symptom, but instead you can act rationally. Next, we're going to move on to past medical history. Past medical history is important because of this. You go to do your head to toe assessment. Your patient's respirations are 23, 24 breaths per minute. You start to panic. You're a new grad nurse. You don't know what the hell you're doing. You're like, my patient's gonna croak. Your patient's not gonna croak. Your patient actually has COPD and they breathe a little faster than normal people, but you didn't know that because you didn't read their past medical history. The next one is pretty self-explanatory, and it's allergies. You don't want to give your patient anything that they're allergic to, and you don't want to bring any allergens into their room. Next one is super important. You want to know a patient's code status. You come into the room, your patient's not breathing. You have no idea what their code status is. What do you do? We want to be able to respect people's medical directives. If somebody is a DNR and you do compressions, you bring them back, they didn't want to be brought back. That is a huge liability, not only for you, but for also the hospital. Number 5, activity and safety orders. You walk into your patient's room, your patient is like, "Hey, can you help me up to go to the bathroom?" You help your patient up to go to the bathroom. She's a 90-year-old lady. She falls and she breaks both of her hips and her clavicle and her left arm. A safety and activity order for this patient would have been that she needs to use a bedpan or briefs to go to the bathroom, but you didn't read her activity orders, and that's why it's important for you to know that. Lastly is diet. This one seems so insignificant sometimes, but it actually is really quite important, especially with confused or not so alert and oriented patients. You walk into a patient's room at 7 in the morning. The patient goes, "Hey, can I have a glass of water?" You say, "Sure." You give this patient a glass of water. They choke. This patient is actually on thick liquids only, but you didn't realize that because you didn't read their diet. She's currently choking. Go get your patient. That is it for this video, guys. Keep your nursing full of grace and keep a smile on your face. Let me know what you guys would like to see next.